Hello everybody. In the series of road safety pioneers, road safety educational courses, in this presentation I want to talk about the road safety performance indicators, or RSPIs, and we talk about the definition and why we need this and what really we exactly mean when we are talking about RSPI. So we'll start this presentation and go on, and we will try to cover all of the topics around the road safety performance indicators. When we talk about the road safety indicator, mainly people, the first thing that comes to mind is when we are talking about comparing maybe countries about what they have done before, in terms of, for example, number of fatalities, and what happened last year, what happened this year, and also maybe comparing different countries, how many of them have experienced an increase in the number of fatalities, and how many of them maybe observed decrease in this rate. So when we talk about the road safety performance indicators, we are not only talking about this types of indicators. In fact, we are not talking about this. These are one type of indicators that many call the final outcome, that what happened at the very last stage of the chain of events of accidents. So maybe the question is what is the RSPI definition? We have here two definitions. One, the first from ETSC, that defines it as any measurement that is causally related to crashes or injuries, used in addition to a count of crashes or injuries in order to indicate safety performance or understand the process that leads to accidents. So it's very important that it highly related to the process that leads to an accident or different type of accidents. But in the safety net project that done in the European Union, there is a definition, and also some of the proposals are using and maybe define and then select and then using the RSPI. So it started, safety performance indicators are defined as the measures reflecting those operational conditions of the road traffic system which influence the system's safety performance. The purpose of SPIs is to reflect the current safety condition of a road traffic system. For example, they are considered not necessarily in the context of a specific safety measure, but in the context of specific safety problem or safety gaps. The next is to measure the influence of various safety intervention, but not a stage or level of application of particular measures. And the third is to compare different road traffic systems, for example, among countries, regions, and others. So it's very important to be aware of what's the purpose of using the road safety performance indicators. However, we somehow got familiar with the RSPIs, but still we need to know more about why we need road safety performance indicators. Fundamental road safety assessment is based on the number of accidents, fatalities, and injuries However, such data do not provide all the necessary information. So sometimes we look at road fatalities data and road injuries data. They tell us about different things, but not all the facts behind the injuries, all the facts behind that, what happened, what's the main routes, what's the causes, which behaviors are causing these accident and injuries. But they are not telling us these facts, and we need to use other ways to reach to such a underlying data. The assessment of the current safety condition of a road system and the monitoring of their progress is achieved with the use of additional safety indicators such as seatbelt use rate, helmet use rates, operating speeds, drinking and driving rates, to ensure we are moving towards our defined target. So it's very important, some of the words here. So we need targets. We need targets to, for example, I don't know, 30% reduction for or 50% for 10 years. We must have such a target, and we need some measures to be sure we are on the right track. We are walking towards our goal. Without any measure, we are not sure if we are going the right way or not. So also the highlight, it's a way to highlight the emergence of developing problems at an earlier stage before these problems show up in the form of accidents. In some scientific research, as you find, some scientists work on near crashes instead of crashes and injuries. So it's somehow maybe how to define the near crashes is not the same among all of the scientists, but more or less they believe that if we start counting and funding them and go through the main root causes, it would be very useful to predict what will happen in maybe next 2-3 years, and we will be able to highlight it, detect it, and start some intervention to stop the developing problems. Of course, goal setting is very important. Maybe the main thing we should think about that and do that. It's very famous sentence: if you don't know where you're going, every road will get you nowhere. So of course we need some goals and some interim targets to be achieved, so help us, as we talked about, that we are moving towards our goals, and all the it's a kind of evaluation, and helps us to make sure that we are doing the right things at the right time. But of course the targets we need must be quantitative, so we should be able to measure it in different ways. Of course, research and experiences indicate that long-term goals and interim targets, if we set such targets, of course, they lead to increased political will and stakeholder accountability for road safety. So it's very important that all the people, the high level, maybe minister, even the president, I don't know, all the people are aware that we need a certain amount of reduction or improvement that it's measurable, it's tangible, and we need some data, getting some data about that. And for the last year, and we have started something, for example, and now the first 6 months we want to know if we have been able to observe any improvement or not. Also, closer management of strategies and programs, better safety programs and better safety performance, especially when targets are ambitious. For example, at the very beginning of the decade of action for road safety, it was told that we need to, if we don't do anything, probably the number of fatalities around the world will be something like doubled, and with taken actions we want to, in the first stage, stop the growing trend, and then reduce the number, the predicted number, by 50%. So it's targets, of course, an ambitious target, and we need to manage everything and sit around the circle, around the round table. We need to work together and go through teamwork to be able to achieve that ambitious target. Also, better use of public resource and increase motivation of stakeholders. So when we have some data and have some targets that are quantitative, and of course it will tell us that we should think about that, how to achieve that goals, and tell everybody that we need your help to achieve this target. In the global status report published by WHO, in the country profile section, you are able to see not only trends for reported road traffic deaths per 100,000 population of the countries. Also, there are different items in that, and for example, safer vehicles, institutional framework, safer roads, and in different section you can see that, for example, for enforcement levels, seat per rate, there are some data and that have been gathered or have been estimated from local countries and locals in the countries, and of course they give you more info, not only just how many people are dying in that country, but also different things can be understood about what's happening behind that number, and it's very useful for comparing road safety situation among the countries. Sustainable development goals also the year of 2015 it was announced that there would be something like 17 goals for sustainable development all around the world, and or called SDGs in brief. And in two sections, 3.6 and 11.2, we see that road safety has been addressed. In 3.6 section, we see that the target SDG says that seeks to reduce road traffic deaths and injuries by 50% by 2020. And in 11.2 says that aims to provide access to safe, affordable, accessible, and sustainable transport by 2030. That's how it's the first one is very difficult to achieve, since we do know that it's very tough work and need huge amount of work and funds. So we saw that in just last year, in 2017, the road safety fund was discussed, and of course it stated that there are a need for a lot of funding in this area, and it's very vital to achieve these ambitious goals. After goal setting stage, of course, we need some plan to do it. The goal without the plan is just a wish. So having maybe complete and well organized and based on best practices plan will help us to reach our defined long-term and also mid-term target. And without the plan, of course it would be impossible to reach our goals. At the beginning of the decade of action for road safety, the WHO and UN published a global plan for this decade, and in the different sections we are able to see that monitoring and using the performance indicators have been addressed in different sections. In the section 4, that is called the framework for the decade of action, and in the first part of that, goal and a specific adjective, we can see that is written that monitoring progress and performance on a number of predefined indicators at the national, regional, and global level. So it's very important that it has been mentioned at the beginning of the decade in the global plan. And also we do know that there are 5 pillars for the decade of action in this global plan. The first pillar mainly talks about road safety management, and in the 5th section of that, we can see the title is Monitoring and Evaluation of the Decade of Action for Road Safety. And again, in this part, it has been mentioned that progress towards achievement of the decade goal will be monitored through monitoring of indicators, tracking milestone linked to the decade, and midterm and end-term evaluation of the decade. So of course it's very important how to monitor, and of course use some measures. So we're calling it the road safety performance indicators here. From framework view, the road safety management system, you can see here, firstly presented by Bliss and Brains. There are different sections. On the top you can see outputs, intermediate outcomes, final outcomes, and social costs. The final stage or the final goal would be reducing the socioeconomic costs of the crashes and accidents and injuries, of course. So to achieve that final goal, we should go through the final outcomes, that the number of accidents and injuries, and to reduce that, of course, we should go through some root causes called intermediate outcomes that maybe they can be speeding and some other factors that are intermediate outcomes, and before that we are working outward. In the layer below, there are interventions that mainly on road network planning, design, and entry and exit of vehicles and drivers, and recovery and rehabilitation of crash victims. So it's very important how we plan and implement interventions. At the bottom, we are able to see different paths called coordination, legislation, funding, promotion, monitoring and evaluation, and R&D. So these are mainly called IMF or institutional management functions that are very important. How we are working on the system, where to start, and go step by step to reach the final goal that would be reducing the socioeconomic cost of the crashes to the society. From framework view, the road safety management system, you can see here, firstly presented by Bliss and Brains. There are different sections. On the top you can see outputs, intermediate outcomes, final outcomes, and social costs. The final stage or the final goal would be reducing the socioeconomic costs of the crashes and accidents and injuries, of course. So to achieve that final goal, we should go through the final outcomes, that the number of accidents and injuries, and to reduce that, of course, we should go through some root causes called intermediate outcomes that maybe they can be speeding and some other factors that are intermediate outcomes, and before that we are working outward. In the layer below, there are interventions that mainly on road network planning, design, and entry and exit of vehicles and drivers, and recovery and rehabilitation of crash victims. So it's very important how we plan and implement interventions. At the bottom, we are able to see different paths called coordination, legislation, funding, promotion, monitoring and evaluation, and R&D. So these are mainly called IMF or institutional management functions that are very important. How we are working on the system, where to start, and go step by step to reach the final goal that would be reducing the socioeconomic cost of the crashes to the society. But of course, as we talked in the lowest layer, we talked about the road safety monitoring process that mainly starts with set of aims and objectives, as we talked about that before, and then select some performance indicators, then go through which data we need to collect, and collection of data, getting data, and then go to analysis stage. And of course the final stage would be the review and implementation of some intervention. So after that, of course, we need to set new aims and objectives, or maybe go to upper level, define new interim targets, and of course this would be a process like a cycle that help us to improve and improve more. Of course, we need to benchmark at any program you are aiming to do. There are some questions. For example, the first is where I want to go, where I'm standing now, and what are the stages between two. And this called mainly benchmarking, when in how many stages you want to reach your goal from your place at the current situation and your desired situation. So it's mainly called benchmarking. Starts with developing set of indicators and instruments and comparing and analyzing with best in class or best practices, determining and understanding gaps in performance, then identifying potential improvements, go through implementation, do the evaluation, and comparing with whom and how, and of course again developing indicators. So it's the same, more or less the same what we are doing. It's a cycle of improvement, and you in each time you go to upper level and improve the quality. In this case we are talking about, of course, safety of our roads. To highlight the importance of this topic, I'm eager to say that in November 2017, member states concluded work on the development of a comprehensive set of 12 voluntary global performance targets for road safety. And during these discussions, they invited WHO and other UN agencies to continue the work by developing a set of related indicators, and to completing that, informal consultation of member states on road safety indicators was convened on February 2018, and the consultation attended by representatives from more than 35 member states, and debated over 33 proposed indicators that you can find the draft version, the final version on the UN website. This conclusion set of indicators covering process and outcomes for each of the 12 global targets was identified by the group, and indicators aligned with the global targets will help to guide action and ensure measurement of the progress at the national and global levels. This is the first page of the discussion paper. You can find the complete file on the UN website, and it is completely explained in that document that what happened from the very earliest stage to the final outcomes, and why it's important to use the road safety performance indicators. In this document, in the first part, you can find this topic that why do we need global indicators, and there it is explained that indicators as we talked about that before, provide a mean to monitor the extent of the progress, and also an indicator will be used to assess the progress, and countries have managed to improve the road safety have shown that doing so is aided by setting targets and reporting on progress towards those targets, and also this can serve to maintain momentum and action towards national road safety efforts in support of positive impacts. As an example, here you can see Sweden road safety performance indicators, and in the first column you can see the indicators and starting position, what happened in the 2010 and target year 2020, and what's the trend, for example, the first number of fatalities, and better to go to lowest one, the percentage of safe crossing in main municipal road network for cars. The position is 50%, but the target has not defined yet, but maybe the third one from the bottom, percentage of traffic volume on road with a speed limit of more than 80 km/h and median barrier. The starting has been 50%, on 2010 67, and the target 75%, and the trend says that in line with the required trend, so it's okay. And you can see in the some red cells that they are not in line with the required trend, and they need to work more on that. For example, for wearing seat belt in the front seat, that it had been 96% at the start point, and now not so many changes when they have measured it again. There are different criteria for selection of indicators. In this document, there are 5 that we can see. It is mentioned that be strongly associated with the injury or fatality occurrence, and sensitive to changes, being have a clear operational definition and feasible monitoring mechanism, and feasible for the countries to collect, and be supported by existing data sources that can be used to establish. So there are some criteria in this document by the UN that all the countries have agreed to do that, but in some other sources we may see that other criteria has been defined as well. As an example, in research by Hermans, Brayson, Vets, they've defined some other criteria as well, being relevant and valid, being measurable, being understandable for everybody, and based on available data, being reliable, comparable and coherent, and be specific and sensitive, that you may see some definitions, some question you must ask yourself before selecting that indicator, and it's very useful when you're doing on your own country or region. At the end of the comments, there are 2 main tables, set of tables. The first is candidate indicators for global targets that to be discussed and agreed upon by member states. You can see target 1, for example, by 2020 all countries establish comprehensive multi-sectoral national road safety action plan with time-bound targets. And the second column talk about the global indicator for target number of countries with published national action plan with time-bound targets, of course. And in the third column you can see the data source that link on government website or WHO global status report. You can see different items for target 1 to target 12 in this table. In the second set of tables, there are some examples of actions and national indicators for targets. That's it is mentioned it's only for information, and there are 4 columns here: the target again, and example actions, process to be taken. There are some hints and indicators for progress, and the national indicator for target. It's the second set of tables that maybe help different countries to start and work on that. These are the 12 targets by member states and agreed on that. You can see different colors are related to different pillars. So 1 and 2 for the first pillar, establish a national road safety action plan, accede to UN legal instruments, and 3 and 4 build new roads according to recognized standards. Number 4, improve existing roads according to recognized standards. Some of them you can see, for example, for number 4, they have some quantitative targets. Here is 75%, but unfortunately in maybe half of them we cannot observe any quantitative target. As we talked about, that is very necessary to set something measurable, and how many percent, for example, increase are we like the Swedish targets I showed you on the previous slides. So maybe some targets here lack measurable, and they can't be measured very clearly. It's the main weak point of these 12 some of these 12 targets. But in the 5 and number 5, you can see they apply high quality standard to new and used vehicles. 100% of them reduce speeding by 50%, increase correct use of standard helmets. These are mainly for the road users. The fourth pillar for road users behavior, and also some others for drink driving, using mobile phones, and the driving times and rest periods for professional drivers. And the last one is about minimize the time between crash and emergency care. Mainly we have the golden time, so it's very clear, maybe such a standard all over the board, and maybe we need some exact number here, for example, I don't know, 12 minutes, 15 minutes, something like that. But minimize, it's somehow general term. So if for example in your country is 40 minutes on average and you minimize it to 35 minutes, it's fine. Also if it's your 18 minutes and you reduce it to 15 minutes, also it's fine. So it's not the same among different countries, and we need to set a quantitative target here. It's one of the deficiencies we have among these defined 12 targets. There is no globally accepted way of placing the road safety performance indicators in road safety system. So you may see in different documents that different people, different organizations, and different scientists use various ways to place the RSPIs in categories. For example, here you may see that there are human behavior, vehicles, road infrastructure, organization and rescue services, and in other categories, of course, you may find different ways. And here, for example, we have road safety problems in this graph, and also road safety measures in the other section. And you can see there are different ways. For example, alcoholics and enforcement are related to the alcohol or drink driving problem. as a road safety problem, and it's a part of the human behavior road safety issue. Apart from that, we should be aware that also there's some exposure or risk exposure data called RED. For example, how many vehicle kilometers cars and other vehicles are driving in among the road network, and also some concerns about fuel consumption and person kilometers, number of trips, and time in traffic. There are some risk exposures data that may have an effect on our performance indicators, such as alcohol, speed, protective system, fatigue, and other things. And also there's some context variables such as age and gender, and also vehicle age, make, and model, and about the network variables, area type, road type, speed limit. Of course, they're different from country to country, region to region. So when we are using the same performance measures for all types of cause, we should be aware that difference in this risk exposures and also these variables may have an effect on their results from measuring their road safety performance indicators. In the safety net research, as we talked about that before, there are different safety areas and develop indicators for that area. For example, we have alcohol and drugs, speed, protective systems, DRL or daytime running lights, vehicles, mainly about passive safety, and roads. In each area, in each safety area, we are able to see, for example, in alcohol and drugs, in alcohol, for example, the indicator is percentage of fatalities resulting from crashes involving at least one driver impaired by alcohol, and for drugs the same. For example, for speed, we have the mean speed, the 85th percentile speed, the percentage of speed limit offenders by road type, vehicle type, period of day, and other things. And also we may see different items for different safety areas. Also in this research, we may see that for thermal management there are different indicators have been defined. Availability of emergency medical services stations. So in this case, the indicator is number of EMS stations per 10,000 citizens and per 100 kilometer lengths of rural public roads, and other things such as total thermal care beds and number of thermal care beds per 10,000 citizens. In another research by Al-Haji, we are able to see that he talks about mainly about different factors that influencing the RSPIs. For example, factors influencing the exposure to traffic, like economic factors, per capita, urban population density, and type of travel mode choice. Also factor influencing risk of accident to driver, to groups of road users, to vehicles, to roads, and to environments such as darkness, fog, ice, and something like that. And factors influencing accident severity, also categorized into different groups, like human factors, again speed, helmets worn by users, and the vehicle, like passive safety, crash protective roadsides, guardrails, and poor rescue and pre-hospital emergency care, and poor city health care system. The different factors that may have an effect, and he stressed on that you may speed in different categories. For example, in risk of accident, the driver speed is a factor. Also, when we are talking about factors influencing accident severity, again in human factor, speed is a sub-factor. So we should be aware that it's not very easy how to categorize these factors and put RSPIs in categories. Based on factors we talked about in the previous slide, Al-Haji finally comes to an end with the categorizing these road safety performance indicators, and he defines the core dimensions in 7 categories, and then starts to define the measuring the indicators. So the main core dimensions are traffic risk, personal risk, road user behavior, vehicle safety, road safety, socio-economic indicators, and traffic police and enforcement. So it's some kind of categories he has used in his research that some people agree, and some scientists do not agree with all of that, and go through other types of categorization of the RSPIs. At the beginning, we talked about the 5 pillars of decade of action. So mainly in recent years, many scientists, when talking about the road safety performance indicators, they do believe that we should respect to these 5 pillars, and put that those defined performance indicators into these 5 pillars, as we observed that in the UN document that have been published recently, they use the same way of these 5 pillars. In remained slides of my presentation, I'm just giving you some examples from different documents that they've used different performance indicators for different pillars, I mean 5 pillars. So if we start with the first pillar, that is about road safety management, we mainly see some indicators mainly called institutional management performance indicators, and they mainly talk about the how lead agency are working, how coordination is working in the country, and how different stakeholders are playing their role in road safety to push it forward and decrease the outcomes, and lower the number of fatalities as a final outcome, and also the socio-economic effects. So for example, here's some example of that: percent participation of the lead agency's supreme authority in the meetings, the government contribution in funding, number of educational campaigns by NGOs, per capita educational budget, and insurance companies' contribution, and share of safety in the research budget of the Road Safety Commission. And in each country, of course, you may see different words, but the main context is the same, and it's mainly talking about how we are managing, how teamwork, how coordination is helping, and what's the situation when we are able, how we are able to measure it is very important here. Under the second pillar, safer roads, we also have some performance indicators here that could be percentage of road network with unclear hierarchy functions, percentage of high-speed roads with incompatible vehicles in terms of mass, length of road section violating drivers' expectation and increasing workload. It's mainly related to design, the road design, and how if we go through the recent work by star rating by IRAP, that mainly we're talking about that we need 3-star roads or better. So also it's another way of measuring the road safety. Maybe they are using different method to rate the safety of that road by giving the stars to that. But of course there are other ways like these using these measures and indicators that will help you to assess the condition of your road network in terms of safety, of course. So of course we may also need to measure the existence of official process of RSI or RSA and official process to check the safety of existing roads, develop walking and cycling policies for investment in public transport as a safer way of transport, of course, mode and effect on people mode choice, and of course need existence of policies for separating road users and protecting VRs and vulnerable road users. The third pillar talks about the safer vehicles, and of course we must have some performance indicators for them. There's some example as well. Percentage of new cars with top star rating according to, I don't know, Global NCAP, Euro NCAP, wherever. In different countries we have different types. For Australia, for Japan, of course, we have different name with the same concept for that. For percentage of vehicles with worn tires, percentage of technically defective vehicles, different indicators, and in general, which type of standards for vehicles the country is using, and how they are implemented, and how we are able to make sure that these standards are exactly being met by the car producers, or the imported cars have the minimum of that. So we need some process to check this and be assured that the vehicles that are moving on the road network are being filtered somewhere, and we are completely sure that they are meeting the standards. Of course, for the fourth pillar on the road user safety, road safety for different type of road users, we may see in WHO publications that they are mainly talking about the 5 key risk areas that are being highlighted and being addressed more than others. These 5 that I mentioned here: drink driving, speeding, helmet, using the child restraints, and also wearing the seatbelt. These are the main 5 key risk areas. You may find exclusive publication document for each on the WHO website with different recommendations how to deal with this issue and how to improve the condition of road safety in each country in this specific area. For drink driving as instance, we have percentage of drivers busy about the legal limit, drivers with a drug concentration about the legal limit, of course, drink driving and drug driving. Treating the same, maybe more or less the same indicators for both of them, and surveyed car drivers disrespecting the alcohol limit, and in drivers impaired by alcohol and drugs, and also fatalities resulting from accident involving at least one driver impaired by drugs or alcohol. So these are some indicators we use in this risk area. Speeding has been mainly one of the most important topics, mainly in recent years, and you know that in 2 years ago, the UN and WHO started raising awareness of the consequences of higher speeds and what's happening when, for example, you have 5% increase in average speed on a highway or road. What happens to number of fatalities and fatal accidents? So we have indicators like the percentage of drivers exceeding the speed limit, and also average free flow speed per road type and vehicle type, and also variation in speed per road type and vehicle type, and also percentage of driver with an inappropriate headway on various road types. At the same way, for seatbelt, we have some performance indicators. For example, the percentage of person wearing a seatbelt in front seat, and another indicator would be for rear seats. Also, we may have different indicator for buses and trucks and different types of vehicles. So mainly it's about how many percent are wearing seat belts, maybe in different conditions, different types of roads. It's very important to know that, for example, in local roads and minor roads, in arterial roads and highways, what's happening and why. For example, in rural roads, the percentage or the rate of wearing a seatbelt is lower than a highway, and what should we do to increase the rate. And the helmet mainly we have for cyclists, moped riders and motorcyclists that we need it by differentiated by gender, age, datum, day of week, months, and or different things. So in different conditions and different roads, we must know that why they are wearing a helmet and why some people are not using that. For example, in some warmer countries, we may see that the rate is lower than other places, and of course some people don't like it because it gives them a limited vision. So maybe different design of a helmet could be helpful for increasing the rate. And the last risk area from the mentioned 5 key risk areas is child restraint. We have also some indicators. The percentage of children under 12 years correctly sitting in a child seat in front, also in rear seat, in the percentage of a child seat used correctly for the age and the children, and also percent of a child seat installed correctly. So it's very important to know in some areas this research has show that in some cases, for example, everything is fine, just the parents are not able to install it correctly, and at the scene of crash we see that the child side seat moves in the car and cause the child being killed, unfortunately. And the 5th and last pillar talks about the post-crash and thermal care system. Also we have some performance indicators here, like average time for intervention at the accident scene, also average casualty transfer time to the hospital and hospitalization duration, and physician nurses training course for medical emergency and emergency room injury surveillance systems, and other factors related to indicators. As I mentioned before, these are just some examples to just make it clear how an indicator could be defined and selected using your predefined criteria, and based on different items we mentioned about the, for example, available data and the ability to be compared with different regions, cities, I don't know, states and other countries as well, to be able to compare your condition with others, and also with yourself, and being better, improve your situation. And of course these are not we can't limit the road safety performance indicators only to these categories. There are all different things like DRLs, how laws and standards are being set, how enforcement level is, and using mobile phone, red light running, jaywalking, I don't know, using reflective device by pedestrian mainly when walking in night at night and or different countries that mainly have more cold seasons, and how the process of taking a driving license is it very easy to get a driving license, and what happen when you do an offense, and what happens to you, what's the judiciary system, and do you have demerit point or not, how effective is it, and the different items could be defined based on your country, the city you're living in, and of course it needs more work and using the criteria to select, and maybe first of all you working out on that on teams of experts, and maybe have brainstorming, and maybe develop a pool of RSPIs, and then go to define your criteria for selection of RSPIs, and then selecting that, and then go through the getting data. And of course you need to have a clear definition for getting data and educate people that want to get at that, because one of the most important problems in this area is when people go for data collection, and since the definition is not enough clear, or the education and training for them have not been enough effective, you may see different results from the same location, so it's not acceptable, and of course it needs more work and takes more time and energy, and you may waste your time and money. So we should be very clear, should be very very precise in earlier stages in definitions, and how to select those indicators. And of course it may take time at the earlier stages, but if you go through that successfully and pass it these first two stages successfully, you will be able to go take the next step with high precise and with more precision, and be more sure that you are doing it correctly. And finally, the final thing that it is the common goal for all of us is saving more lives, and we are working together. There are different ways, different manuals, different guidelines, like the Save Lives package published by the UN, that says S stands for speed management, I for infrastructure design and improvement, E for enforcement of traffic laws, L for leadership, and V for vehicle safety, and S for survival. So it's very important to bear these very important letters in mind and plan for that, and of course go step by step, and wait for the results and decrease in your number of crashes and of course the number of fatalities and injuries. Thank you very much. Just hope that it has been very useful course for you. It's not all about the road safety performance indicators. It was just a start. Of course, there are many details about each topic that I just started and opened the discussion here. So if you have any question or need more documents to think more and read more about that, just email me on Zayerzadeh and at yahoo.com, and thank you for watching and following our presentation. We will be with you with the next presentation in RSP series. Thank you very much. Bye.